We have some new and conflicting data about health care premiums under Obamacare. The Health and Human Services Department announced that nationwide premiums will be 16% lower than initially expected. But some digging by my next guest showed that nationwide premiums will in fact be substantially higher by an average of 99% for young men and 62% for young women. So why the difference in the data? Is the HHS bending the truth? Here now is Avik Roy. He's senior fellow at the Manhattan Institute. Let's start right there. You have a doubling, and HHS has a minus 16%. What's the difference?
Yeah, so they're saying lower than expected. Expected by who? So they're comparing their analysis of the costs of the premiums under Obamacare to what the Congressional Budget Office predicted rates in 2016 would be 6 years ago, or 6 years from 2016, 2010.
So they made their estimates in 2010.
Yeah.
And it's okay.
So
I
it's
got you.
There's put it this way. Let's say there's a car that you can buy today for $20,000. CBO says it will cost $30,000 next year. HHS says it'll cost $29,000 next year. You're still paying $9,000 more, but they're celebrating. Oh well, you know, it's $1,000 less than what CBO said.
There aren't some of these states. I mean, I haven't counted every state. I don't know every state. There's about 35 states that could be involved in these exchanges one way or the other, and they're all different. The numbers are all over the place, and that's the part I found so confusing. Why is that?
Yeah, that has a lot to do with insurance. Health insurance up to this point has been regulated at the state level. So different states, some states have heavily regulated insurance markets where the prices are really high as a result. Some states have relatively deregulated insurance markets where it's more competitive and the prices are lower. Obamacare imposes a one-size-fits-all regulatory scheme on all states, and that means that the states that are lightly regulated today in general will see huge spikes, and the states that are heavily regulated today, like New York State, we'll see some decreases.
Yeah, that's an interesting point. Competition brought prices down before Obamacare and would again. All right, I've got this example from the Wall Street Journal. A 27-year-old young male is not a smoker, okay? And he lives in Nashville, Tennessee, all right? Now, right now, this guy pays minimal insurance plan, costs him $41 a month in Nashville, Tennessee.
Right.
If he goes into Obamacare and takes the low-end bronze package, he jumps from $41 to $114. Now, I would regard that as an increase.
I would too.
Does HHS regard that as an increase?
HHS does not, because HHS is apparently claiming that doesn't matter because the CBO projection is what matters. But yeah, the average American is going to see that as an increase. And think about that. $41 a month, that's less than a cell phone contract. That's less than a phone bill.
Bare bones.
Right?
But bare bones insurance, but if he buys Obamacare, even the cheapest Obamacare, he's got that's more than a double.
But bare bones insurance means that if you get hit by a bus, you have a stroke, you get cancer, you're covered, which is the rhetoric from the left all this time has been that's what we need to look out for. You can buy that today for $41. Obamacare makes it unnecessarily expensive.
Second example. The same, I don't know if it's the same, but another 27-year-old male, okay, non-smoker. Now, he lives in Philadelphia. He's paying now the lowest he can pay, his lowest package in Philly, $73 a month. Philadelphia, big city. The bronze package from Obamacare, which is its cheapest package, puts him up to $195. So he goes from $73 a month to $195 a month if you live in a big city like Philly. Why? Why would someone do that? Why would a young person do that?
This is exactly what I talked about in my Forbes column today. So we did this analysis for every state where HHS allowed us to do the analysis. And the average, as you said, is 99%. Now, that's an average. In some states, like North Carolina, we're seeing 300% increases.
Well,
that's a quadruple.
This guy in Nashville and the other guy in Philadelphia, these are more than doubles.
Right.
They're more than doubles.
So this is the thing, is like Obama administration, they're trying to pay the NFL, they're trying to pay celebrities, they're trying to pitch young men on these insurance products. People are looking at it and say, you know what, I'm perfectly healthy, I never go to the doctor, you want me to spend several $1,000s a year on health insurance? No way, that's a bad
Why
deal.
would they do it? So, all right, well, I want to conclude. Young people are likely not to play. Is that what you're saying?
I think that except for very low-income people who benefit from these subsidies, yes, that's right.
And if the young don't play, then Obamacare is going to have trouble sustaining itself, and you would do the subsidies. Who's going to pay for the subsidies? In other words, everybody's betting on this influx young people.
Yeah.
What if they don't flux in?
Listen, there's been a lot of disagreement about Obamacare, but one thing where the Obama administration, guys like me, agree, if these young people don't sign up and spend a lot more on health insurance than they really need to, Obamacare will not unravel, but it'll be a lot more expensive than it was meant to be, and it will cover a lot less people than it was supposed to.
Who's going to pay for that if it's more expensive?
Taxpayers.
Really? How much? Don't say that. We go. Avik Roy, thank you very much. I think I understand it better now.